I have to say it. You are being lied to if you are believing the outdated suggestion of using birth control to heal your acne. Hear me out. For some, it works. For others, it doesn't. But in this video, I'm going to break it down why birth control is not as effective as it could be for long-term use of healing acne. And I'm going to provide to you information on how to heal your acne naturally. Stick around. True acne healing begins internally first. Acne is essentially an outwardly sign that something internally is off. Therefore, using birth control as a band-aid fix without understanding the root cause of the acne in the first place is a no-no in my opinion. If you are interested in learning about the root causes of acne, you can check out the video up here that I linked up here, where I dive into the five common causes of acne. And so you can get all that information there. Before I take this deep dive into birth control, I do want to make a few things clear. Number one, research does show that birth control does help in clearing acne. Number two, I know I am very much so very, very, very passionate about all things natural. However, I do understand that there are some people who do need to use birth control. And so because of that, I'm not totally against it. I want to make that clear. The last thing that I want to make clear is that I am here. The goal of this video is just to provide an alternative method to clearing acne instead of using birth control. So whatever you want to do with this information is what you want to do with this information. So I just want to make that very clear before we go into it so that you understand where my heart is and where my motive is behind this video. Alrighty, so now that that is out of the way, let's begin with a little history lesson in birth control. Birth control is the use of synthetic hormones to prevent pregnancy by stopping ovulation, thickening cervical mucus, or thinning the uterine lining. The first oral contraceptive pill was initially used for menstrual disorders in 1957, and by 1960 was approved by the FDA and marketed for hormonal birth control use. It wasn't until the 1980s when dermatologists began prescribing birth control for hormonal acne because it reduced male hormones, aka androgens, like testosterone, which contribute in excess oil production and clogged pores. By the early 2000s, the FDA had officially approved certain birth control brands. These brands were Ortho-Tricycline, Yaz, and Intro Step for acne treatment. So next I want to talk about the different types of birth control. So there are 7 different ones. So our first one is called combination oral contraceptives. Then we have progestin-only pills, aka mini pills. We have transdermal patches, vaginal rings, injectable contraceptives, implants, and for our last one, we have hormonal intrauterine devices, aka IUDs. So as you can see, depending on the type of birth control that you are using, it actually determines what hormones are being released in your body. And so for the brands that are utilized for acne treatment specifically, which was the first one that I talked about, the COC type of birth control, those ones actually release the synthetic form of estrogen and then also the synthetic form of progesterone. I believe that it's important that you fully understand why synthetic forms of estrogen and progesterone are being released in your birth control. So essentially, with the release of estrogen, estrogen is lowering an important hormone called follicle stimulating hormone, aka FSH. When this hormone is being reduced, it actually is preventing the maturing of the follicle. And so what a follicle essentially is, once it's matured, it actually ruptures and it releases the egg to be fertilized in the fallopian tube. And so when it comes to the synthetic form of progesterone, what that is doing, it is actually inhibiting another hormone. And this hormone is called the luteinizing hormone, or LH. And so with LH, what that does is if there's low levels of if there's low levels of LH, then it stops ovulation. And with stopping ovulation, that's also decreasing the amount of testosterone in your body as well, or testosterone being released. And so with low levels of LH, low levels of testosterone, what that is doing, it's creating this environment in your body that is thickening up the cervical mucus. So then that is preventing the sperm to actually get to the egg. And then it's also thinning out the uterus, which then is preventing the implantation of the actual egg. And so all of these things are preventing pregnancy from occurring. Essentially, what is going on when you're utilizing birth control is that your body is mimicking the state of pregnancy with the high levels of estrogen and the high levels of progesterone, and with the low levels of LH and FSH. However, there's no pregnancy that is occurring. Why this works for acne is because, again, when we have the low levels of LH, that is lowering the release of testosterone. And so with the low levels of testosterone, we're avoiding or preventing the clogged pores, and we're also preventing the oily skin. And so I think it's important to remember that even though all of this is going on, we have to remember that all of this is happening under the guise of fake hormones or synthetic hormones, while your natural hormones are actually being suppressed. Before we go any further, I would love to bring your attention to a guide I made inspired by those who want to clear their acne naturally without the use of medications such as birth control, Accutane, or antibiotics. The name of this guide is called the No Pill Acne Solution. In this guide, I get you started on your journey to healing your acne naturally by explaining the 5 common root causes of acne and provide you with simple solutions to begin. You can find this guide in the description below. Going back to what I was speaking about when I was saying that we have to remember that the synthetic hormones are the ones that are doing the job in the first place, right? And so that suppression of your natural hormones, to me, is the problem that I don't like of birth control being a solution or a Band-Aid fix to acne. And the reason why is because I believe that the use of birth control is actually, especially over a long time, I believe that it's doing more harm than it is actually doing good. And so, number one reason why it's doing more harm is because I really truly believe that it's disconnecting you from your body, right? The fact that it's utilizing synthetic hormones and your natural hormones are being suppressed, you are not in tune with the natural rhythms of your body. And I believe that that is so important because you need to know like your symptoms. You need to know like what your body does within each cycle of your monthly period. Like those are all important things. And then on a deeper, more emotional level, I believe that that connection with the body is also helping you producing that self-love, that self-appreciation, and that self-confidence that comes with knowing your body, being comfortable in your skin. And so that, to me, is one of the main reasons why I'm not the biggest fan of birth control. And then on top of that, there's the health risks that come with taking birth control. These health risks of possible cancer, breast cancer, cervical cancer, blood clots, stroke, heart attack, what else? Weight gain, depression, anxiety. To me, that is like not enough for me personally to take birth control to help acne, especially when there's a natural solution. And I do want to talk about one more problem that I have with taking again birth control for acne is the nutritional deficiencies that actually occur too. And so again, with that long-term use of birth control, now you are deficient of, what is it? It's magnesium, selenium, zinc, vitamin C and E, also vitamins, I think it's like, I believe it's B2, B6, B9, which is folate, and B12. So like you are deficient of all of these nutrients that are important and vital, and especially like I think about like zinc. Zinc is a really important one for healing of the skin. And so it's just kind of like you're putting yourself in this cycle of depleting yourself in one nutrient, well, in several nutrients that could actually be beneficial to your health. And so essentially, long story short, so I don't go on and on about it, I do not believe that birth control specifically used for acne is not effective for the long-term use. So then you're probably thinking, okay, Dr. Symone, what should I do instead? Here is the thing, and this is where I relish, honestly. I relish in giving people like alternative methods to health because it's possible. So the first thing that I think is super duper important is that you decide. I again want to just reiterate that birth control does help with reducing acne. So like, because that is an actual factual statement, I do understand that not everybody wants to get off of birth control. Also, you could be taking birth control because you want to stop conception, like you don't want to have kids right now. So if that is the case, then I would recommend, having that internal dialogue, the come to Jesus moment, and you making the decision on what it is that is best for your lifestyle. I also understand that some people are afraid of, once they come off the birth control, like what's going to happen. And honestly, that is a very logical understanding, but it's kind of like one of those things where you got to just rip the band-aid off and just see what it is, because you could be surprised and maybe you don't have, these wild symptoms, or maybe you do. And then that is why number two, it's like, once you've made the decision on, yes, I want to get off birth control, or I don't even want to start birth control, I'm looking for that alternative method, the best thing to do next is to find a trusted natural functional medicine doctor who can help you hold your hand through the process so that it won't be as taxing as it is doing it by yourself. Because the best thing to do is actually to come off of birth control cold turkey. Because, when you're taking birth control anyways, you have to take it the same day, or every day at the same time. Or if it's like a IUD or something like that, you have to get it removed. So essentially what I'm just trying to get at is like, it's best to work with someone who has experience in that area of hormonal acne, who has experience in hormones, and they can help you through the process of it. Also, with working with someone like myself, if you would like to, we can order functional labs, especially if you're talking to, again, a functional medicine doctor, a naturopathic doctor, whomever it may be. They can order functional labs for you. And those are really crucial, especially when we're dealing with the state of you're coming off of, birth control for a long term. It's just nice to be able to look at where your labs are at to understand your levels of things so that we can really nourish you efficiently and effectively. So now that you have, chosen your trusted naturopathic doctor, now for the third step I would suggest is that when you are coming off of birth control, your body is going to essentially start the resetting process, right? And it's going to start to figure out your natural rhythms. And so this may take up to 30 days to possibly even, like, I would say probably 4 months for your body to get back into its natural rhythm, for you to actually see like what your period actually looks like. What are the symptoms? What are your hormones doing? You'll be able to see that. I would say like give yourself about 30 days to about 4 months just to see. It all really depends on your body. And so during that process of the resetting of your body, here are some things that I would suggest that you begin doing to help support your liver and to help support that detox process. Eating or drinking liver supporting herbs like burdock, dandelion, and milk thistle. Eating sulfur rich foods such as sprouts, broccoli, eggs, onions, garlic, cabbage, and Brussels sprouts. Doing sweat inducing activities such as exercising in infrared saunas or steams, eating nutrient-dense meals, green juices and smoothies, and then consider taking a multivitamin that contains vitamin B2, B6, folate, B12, vitamin C, vitamin E, magnesium, zinc, and selenium. Make sure that this multivitamin does not contain biotin. And then I would also suggest that you take a supplement of liposomal glutathione and or an NAC supplement. Now, if you are wanting a full breakdown of a 30-day post-birth control body reset regimen, watch this next video. In this video, I explain what I would do if I was coming off of birth control and how I would handle the post-birth control symptoms. See you in the next video. Bye.